Hi y'all, welcome back to Southern Digest, and this is the channel that gives you news, stories, humor, and information that I find interesting of enduring value in condensed form. And this is another news you may have missed or news I missed segment. I'm reading again in the Epic Times. This is a March 2021 edition, and the title of the headline reads, Study, CDC overstated COVID-19 deaths. A little-noticed peer-reviewed study published last October by a science and public health journal claims the Centers for Disease Control and Prevention, the CDC, ignored federal laws and regulations when it changed how the government counts deaths from COVID-19 caused by the CCP virus, also known as the novel coronavirus. And by the way, that journal it was published in was the Journal of Science, Public Health Policy, and Law. And in it, the author said that the revised fatality counting system, with changes that weren't announced or made subject to public comment as required by federal law, raises concerns, according to the authors. They said based on data for all recorded U.S. deaths through August 23rd, 2020, the new CDC system counted 161,392 deaths that were attributed to the virus. Using the older system, the death total was only 9,684. It also states that the essential difference between the old and the new systems was that the new system includes multiple comorbidities along with the virus, and listing the virus as the cause of death and the comorbidities as contributing conditions. So it said the study pointed to the CDC weekly alert on August 23rd, 2020 that stated for 6% of deaths, COVID-19 was the only cause mentioned. For deaths with conditions or causes in addition to COVID-19, on average, there were 2.6 additional conditions or causes per death. So that means of all the deaths that they were counting, only 6% were directly from COVID. And of all the rest that were attributed to COVID, there were an average of 2.6 additional comorbidities. The same weekly alert updated March 14th of 2021, so we're talking about, 7 months later? 7 or 8 months later. For 6% of these deaths, COVID-19 was the only cause mentioned, so that did not change. For deaths with conditions or causes in addition to COVID-19, on average, there were 3.8 additional causes per death. That's a pretty interesting statement right there. They remain, by the way, the old system remains in use today for all causes of death except where COVID is involved. Only with COVID are they using the new system for counting. Now, PolitiFact, a journalism fact-checking website, addressed the study indirectly in rating a National File post about it as false and saying, the study does not definitively say that the CDC inflated COVID deaths. Rather, it calls into question guidelines the CDC issued in March 2020 that were designed to more accurately capture mortality data related to the coronavirus. I find that pretty interesting what they're arguing right there. Anyway, the article goes on to say, in fact, though, while the study doesn't say the CDC inflated COVID deaths, unquote, it does claim the change in data counting procedures produced the wide divergence in total of fatalities as of August 23rd, 2020, 161,392 versus 9,684. So I thought that was very interesting. I had missed seeing that one. Wonder if you saw it and what your thoughts on that are.